So Dr. Huffaker, I just want to ask you a couple of questions about breast augmentation, but first of all, what is exactly breast augmentation?
Well, Michelle, breast augmentation is the placement of an implant, either saline or silicone, beneath the breast tissue, either on top of the muscle or below the muscle. We use different incisions, but basically it's the breast enhancement. It gives the lady a larger breast, maybe one that she lost with weight loss or pregnancy, or just one that she never had.
So is there anyone that's not a candidate for breast augmentation?
Well, it really depends upon their medical picture. Obviously, someone with some medical problems, severe medical problems, may not be a good candidate. There are some medical issues we can get around, even people with coagulation abnormalities we can get around with consultations from the hematologist. It really depends. We take a good medical history when patients come in, so we're aware of these issues and can advise them one way or another.
Now, you mentioned before, for breast augmentation, a woman that's possibly has lost volume after pregnancy. Would you recommend having implants before pregnancy, or is it best to wait till afterwards to see how much volume you lost?
Before is probably better. You know, we see a lot of women coming into the office after their pregnancy who's never had breast implants for filling them up. We rarely see people with implants after pregnancy for revisions, so that they go through pregnancy quite well.
So can you breastfeed when you have implants in?
Sure, no problem with that at all. The implants beneath your breast tissue, beneath your muscle, and so that it even when we do a nipple incision, people can breastfeed without any trouble.
Now, you just mentioned that the implant goes under the muscle. Is that how all procedures are performed?
Most of the time, you know, it varies from one doctor's experience to another. There's not an absolute right or wrong way. Probably 99% of the implants I prefer underneath the muscle. I think the result's more natural. I think it'll last longer. Years ago, I used to do all of them on top of the muscle because that's the way we did them. So I have a lot of experience with on top of the muscle implants, but I think that underneath the muscle will look better and last longer.
And so what type of implants are available?
We have saline implants, we have silicone implants, there's also a cohesive gel implant that's still considered experimental. So we can use all three.
Is one implant better than the other?
Well, in my personal opinion, I feel that silicone themselves are better than saline for the long haul. Saline works well for a young girl with tight tissues, flat-breasted, but as you get older and you lose volume, saline works less well because as your tissues get thinner, you can feel the implant more. If your tissues are thin, you can feel the silicone implant. It feels more like a real breast, and so I prefer the silicone gel. But comparing the silicone gel to the cohesive gel, they are different types of implants, and they're just different. Just like two models of a car are different, they have different features, and you can't really say one model is better than the other. It depends upon which features you like.
So let's talk about incision site. And does it matter does incision site vary upon the patient, or more what implant they pick out?
Some of both. Saline implant we can put in through either incision. We can either the armpit area, the nipple area, or what we call the crease incision. With silicone, we can put them in through the nipple incision or the crease incision. We just can't get them in through the armpit unless we use a really small implant. But with the nipple incision, if they have a real small areola, probably not a good idea for a silicone implant. There are limits as to what we can put the implant through. You can do the surgery through a tiny hole opening, but the implant, the bigger the implant is, the more space it takes to go in.
Now, you just mentioned, depends upon what size implant. How does a woman pick out what size? I would think, you know, being an A, B cup your whole life, it's hard to imagine what you look like with a C or a D or a double D breast.
Well, you know, it's really simple with our system. Admittedly, it's the biggest problem that a lady has when she comes in. A lot of time women If they're A cup, B cup sounds awfully large to them, and they're concerned about going too large. So that most women want to be large but not too large, and whatever that is, we try to determine. But basically, we put them through what we call sizing. We have them try bras with inserts on with their own clothes and see how they look. And additionally, I like patients to look at nude photos, Playboy type pictures, pictures they made in magazines or off the internet. It helps me to know what they don't like as well, what's too large, what's too small, about right. Basically, what types of breasts are you finding attractive? Will they fit on your breast, or you feel it fit on your chest? We spend a lot of time with size. It's really quite unusual for a lady to be unhappy with this size breast implant. So the main thing is that you keep an open mind as you go through the sizing process. Don't try to pick a cup size. We can't guarantee cup sizes. Pick what looks good. Sometimes ladies will look at a picture and say, well, what size is that? What size is that? The main thing is that you like the way it looks. So that, I tell women that we can't guarantee cup size. The main thing is that when you look in the mirror, I want you to like what you see and whatever cup you fit into, because bras are all over the place as to how they're measured.
So let's talk about the surgery. How long is it? Do you stay overnight? What's all involved?
Usually, if we're doing this without a lift at all, the surgery itself is about an hour. We add another half hour on to put you to sleep and wake you up, and that's a little bit variable. The surgery time is fairly constant. Sometimes it takes longer to wake somebody up or put them to sleep than someone else. So it's an hour and a half, maybe as long as 2 hours at the very most if there's been an anesthesia delay. But it's all outpatient. It's not a procedure that you have to stay overnight unless you're having a combination of procedures done that may require you to stay overnight.
Okay, so what's the recovery like? I think that's what everybody's question is. How painful is this going to be?
We try to make it as easy as possible. Certainly with any surgery there is some discomfort. We normally use a pain pump. A pain pump is a little reservoir of numbing medicine that has a little tiny catheter about the size of a paperclip that goes in the side of the breast pocket and drips in numbing medicine. It's not a narcotics, it's nothing dangerous, it's just numbing medicine, long-acting numbing medicine. This numbing medicine lasts for about 18 hours, so it's a very long-acting. And it drips in for about 2.5 to 3 days. It really helps a lot with the discomfort. We also give you pain pills. If you don't have any allergies to sulfa, we will give you Celebrex, which is a long-acting anesthetic, or long-acting anti-inflammatory medicine that does not have any bleeding effects, and we're able to give that to you ahead of time and for a few days after surgery. We also give you a muscle relaxant to help relax the muscles. A lot of the pain comes from the tightness or spasm in the muscles themselves. So we don't try to minimize this. We try to give you everything we can to help you through this. We don't try to give you just a minimum amount of pain medicine, a minimum amount of muscle relaxant that you need. We really want this to be as comfortable as possible. There's some discomfort, but it's not bad at all. We encourage motion and early activity after surgery.
So if someone has a desk job or is a student, when can they return to work?
This varies from surgeon to surgeon and what they like. I like the patients to wait until about the 5th day to return to an 8-hour job. If your times are flexible, if you can work half day, it's sooner than that. It's not pain that limits your activities at this point, it's just stamina. Surgery takes a little bit of stamina out of you, and to go 8 hours without really resting, or sometimes 10 hours with some jobs, it just is more than people like. We've had a lot of employees have this done, and there was always a race to see who can get back the first, but we found that if they came back before about the 5th day, they spent some time lying down in the back room. So I think the 5th day is realistically the best time. But if you have a shorter, more flexible job, or if you're working from home, no big deal.
And then what about exercising?
Exercising, I start out pretty aggressively, I think. Walking is good the first week. At 7 days, they can get on the cardio machines if they like. I like to, between 7 and 14 days on cardio, limit your heart rate, maybe a heart rate below 120. Don't push the max yet. At 2 weeks, you can push the max on cardio. With things like dumbbells, I suggest that people drop the weights down a little bit, a few more reps, and try not to get that last 1 or 2 where you're straining quite a bit. I just don't want you straining hard until after 2 weeks. So I get people back pretty fast. A lot of the patients exercise before surgery on a regular basis, and I find the faster we get them back to the routine, the better off they will be.
So is it typical, or do you require patients that had their implants replaced? I mean, I've heard, every 10 years you need to have them replaced. What's your theory on that?
Well, until they're broken, there's no real reason to replace them necessarily. With saline, I find that they last generally 12 to 15 years, although probably maybe 10% may leak the first, or 8% may leak the first 10 years. With silicone, I find that they normally last at least 20 years. I've had about 9 patients in my career who've had leaks in silicone before 20 years, 2 of those less than 10 years. Normally, if someone notices a leak, it's on a mammogram. If it's an out-and-out rupture where the membrane just gives away, I've just had a couple of those, the patient notices that their breast gets softer than it ever has been before, and so they have an idea that there's something wrong with it. But there's no harm with that. If a saline implant leaks, it gets absorbed into your body. If a silicone implant leaks, it will normally stay inside the little capsule or membrane that forms around the implant, and you'll be completely unaware of it. So I recommend that after 20 years, patients start thinking of reasons to have them replaced. Usually by 20 years, somebody may need more of a lift. Maybe they want a larger size, just variable. Maybe they've had some tightness and they want to get that changed and just switch to a newer implant at the time. There are a lot of reasons. Sometimes people don't have any reasons and they'll come back in 30 years, 40 years. By that time, there's usually a little leakage, at which time maybe there's a little bit more thickening of the membrane around the implant. But it's not a big deal. I've never had anybody come back for a second or third operation to have anything like that fixed.
So what do patients tell you after surgery?
Self-esteem is the biggest thing. They just feel better about themselves because either they're different. 3 basic categories. Either you're dealing with a lady who's never had breasts, who perhaps has never felt as womanly as she could have been. There's a lady who has had moderate-sized breasts, maybe, or large breasts, and have become pregnant, or maybe lost a lot of weight and lost a lot of their breasts, so that they need to have that restored. Or it could be someone who has a moderate-sized breast who just simply wants to go larger to get the look that she likes for personal reasons. So it just varies, but self-esteem is the #1 thing that people report back. They feel better about themselves.